what we want to do is to ensure that these patients have the best possible quality of life. And in having the MDT, what we're doing is making sure that those individualised needs, they get a personalised care plan, that personalised care is really coordinated between people. And actually having that communication between everybody means that everybody knows what each other's doing, which actually means that then as a strapped resource in the NHS, that actually we do the right things with the right people. The Dementia Multidisciplinary Team meeting is kind of what it says in the tin, really. So it's a group of people all from different areas that all help work with those people with dementia. So adult social care, the memory team and dementia care team. We've got Admiral nurses and the link workers who work for the Alzheimer's Society. We've also got things like the community and care coordinators that work in general practice involved, and anybody else that might need to be involved. So for example, sometimes it includes the district nurses, sometimes it can involve the carers as informal carers, sometimes it involves wider relatives or even voluntary sector if they're working to help provide the patients with the best care that they can.
One aspect of any mental health condition is that they are multifactorial. It's unlikely that any one specific, especially medical issue, will be the main aspects of treatment. So clearly here, for addressing those multifactorial problems, be it social or psychological or sometimes safeguarding aspects, we need joined up working. And by joined up working, we can also just reduce the amount of resources we need sometimes, because everything we talk about now comes with waiting time, availability, and when we know clearly that these conditions need a multidisciplinary approach, MDT can solve that problem.
Yeah, in one case we had a patient who ended up being relocated down into South Wales into an appropriate care home placement, but she was also nearest to her relatives. So I think without the MDT that would have been really difficult to actually get coordinated and arranged, but because they had such a coordinated sort of direction with it and were able to help facilitate that and communicate that with the team in South Wales, it meant that that person had the, a really good outcome overall.
We have all the resources we need to bring the care into community, and all we need is that social support and the wider community, so then we'll bring the care so they don't have to go to hospital for that.
I just think that this is such a big thing, and I think it provides a much better experience for patients, carers, family and loved ones overall, as well as helping us as health professionals. I genuinely believe that ultimately we've created a business case for this to be a nationwide approach, and certainly I feel confident that can be replicated elsewhere. It can be adjusted. It's not set in stone, but certainly it provides anybody in any area with a really easy way to kind of start setting these things up, get those relationships and that collaboration going, and then take it in the direction that they feel is really needed for their patients in their areas.